Well, millions of adults in the United States live with opioid use disorder. But depending on your insurance, it can be hard to seek care, especially those on Medicaid. Only a small percentage of people end up receiving the best form of treatment. That's according to a new study out of Northwestern University. To go into that study, we brought in Dr. Lindsay Allen, Assistant Professor of Department of Emergency Medicine at Northwestern University and author of the study. She's joining us now on the stream. We welcome you to the stream to break down what this means and look at why this is happening. So first of all, thank you for being here, and then let's get to the numbers. What's your study finding? What's the highlights?
Yeah, thanks so much for the opportunity to discuss it. So we all know that the opioid addiction crisis has only gotten worse in the last few years. And so it's more important than ever to connect patients to the right treatment. And so we looked at data in 9 states worth of Medicaid enrollees and found that of about 500,000 enrollees with opioid addiction, only 7% were getting residential care. The second main finding that we thought was important is who's getting care. So we saw that those who get care are more likely to be younger, non-Hispanic, white, and male, which doesn't really reflect the trends that we're seeing in the fastest growing populations that end up dying from opioid overdose.
That's fascinating. What are the impacts of not having access to residential treatment centers? And for the folks who don't know, can you explain exactly? I mean, residential treatment is in-house, right? It's where you go to a facility, you stay there, which is probably so needed when you're trying to crack such an addiction that has such a hold on you.
You're absolutely right. And so I can combine responses to both of those points, which is that assuming a patient is a good candidate for residential care, the impact of not having access to that care really depends on the type of residential treatment facility you're talking about. So just like a lot of people still have this misperception that addiction is some sort of moral failing, it's actually a chronic disease, just like diabetes or heart disease, that needs to be medically managed over time. So you want to be treated in a facility that adopts that medical model of care, because we know that that's what works from an evidence-based perspective. So a good indication that you're in good hands at a facility is that it offers medication for opioid use disorder, which we know works to, reduce overdoses and crime rates and improves your ability to get and keep a job. And so the impact of not having access to residential treatment depends on the type of residential treatment facility we're talking about. We want to ensure that people are getting connected to the most evidence-based ones, which if you're missing out on those, the opportunity is, the missed opportunity for healing is pretty big.
Yeah, and it's a little bit in the weeds there, but it's significant to know that people may complain about the cost, or insurers may complain about the cost, but there's significant cost, maybe even greater costs, if you don't have the residential treatment. So what's Illinois' current policy on Medicaid for residential treatment centers? These centers are often private, quite expensive. Let's talk Medicaid and your average Joe insurer.
Yeah, they absolutely can be expensive, but if you think about the cost benefit, there can be real returns on investment for covering residential care. So in Illinois, Medicaid actually does cover residential treatment. And last year, the state implemented something called the State Overdose Response Plan, and that even broadens the attempt beyond Medicaid to cover residential treatment facilities, especially getting that medication available in those facilities.
Okay, we're going to go a little off track on you. It's really a bit of a curveball, a little different one here. But this week we learned the city of Chicago would be putting Narcan vending machines starting at the 95th Red Line station.
Yes.
Basically, Narcan can bring someone back to life who's accidentally or intentionally, who knows, overdosed on certain illicit drugs. How effective are measures like this, not only physically but in breaking the stigma of it, to make it so readily available?
Absolutely. So Narcan is a bit of a miracle product. So
Mm-hmm.
it's really simple to use. Anyone can carry it. I carry it. Anybody can use it. And it can really help save a life, especially in areas where it's going to take a while for a paramedic to get to you.
Mm-hmm.
Okay. And so the idea behind it is that just a ordinary person in the community can provide it to somebody who's experiencing an overdose. And to get to your point about stigma, I think it's important to understand that overdose doesn't have a type. Okay, so
Yes.
it could be anybody, anywhere, anytime that you come across that is overdosing and needs that life-saving intervention. So the more people with Narcan, the better, as far as I'm concerned.
Yeah, when I say stigma, I talk about the generalized thought
Mm-hmm.
approach you previously talked about, where it's some type of moral failing when
Exactly.
actually it's a disease. Dr. Allen, thank you for enlightening us this morning. Assistant Professor of Department of Emergency Medicine at Northwestern University. We will have you on again. Thank you.
Thank you. Have a great rest of your day.
Thanks, Doc.